Many people have now heard and been led to believe that their stem cells are weak, that they don't work well, that they're old. I've done studies as far as 9 years back on the effects of diet, supplements, hormones, and cigarette smoking on cells, on stem cells specifically. And these were pure populations of stem cells that I was doing this research on. In various combinations, we can increase the function of a person's adult stem cells from 2 to 10 times by optimizing the physiology of the body. It's roughly put out there that umbilical stem cells are about 6 times stronger or more potent than a person's own stem cells. Now, if I'm increasing the function of a person's own stem cells by at least that much by improving the chemical niche of that body, the supposed improvement that you get with umbilical cells, which are generally known as allogeneic or outside of a person's body cells, why would we use somebody else's cells to try to heal them? Taken a different way, if I take these supposed much more potent cells from a different source and put them into a person, but we haven't improved the physiology of that body, that's sort of like putting a seed, might be the best seed in the world, into caustic or non-growing soil. And though it might be the best seed, it's not going to grow very well. Take that and flip it the other way. If we improve the physiology of a person's body, improve the physiology of their stems and function of their stem cells, now we have a significantly improved body physiology, which is long-term health and wellness, being treated with its own cells. No matter how you cut this, optimizing a person's physiology and using their own cells is superior to using allogeneic or other source cells. This is true also of amniotic injections. And as I've talked about in other parts of the website, if our focus is getting somebody to feel better, then creating an immunologic reaction via allogeneic or other source cells in an area will make that person feel better. However, at this time I have 6 PhD cell biologists who have written a statement for me that bring forward their concerns about using allogeneic or other source cells in a person, including, are they alive? Because I can tell you that I check every sample of bone marrow and adipose in a patient, and I get 98+% of them alive at the time that I'm injecting a person. I don't know anybody using umbilical cells that checks the viability of them before they put them in. And dead cells do not create the same reaction as live cells. Number 2, you can't guarantee that somebody else's cells put into you are going to be cleaned up and eliminated by the body. And that can create and will create some degree of immunologic reaction that can be detrimental to the person. Number 3, we've also seen in the recent press that there were 12 people that were hospitalized by infected umbilical cells. When you're taking different source, processing it, bottling it, storing it, shipping it, bringing it to a new facility, taking it out, aspirating it, and then injecting it, that's a very different process than taking a person's own tissue, processing it on the spot, and re-injecting it from a possible infection standpoint. There are also concerns that graft versus host disease, which I know is kind of a technical term, that's essentially a cell attacking you. Your cells don't do that. Your cells don't attack you, but another cell from another person could attack you. That can happen on site. All taken together, the risks, the lack of research, and the lack of superiority if a person's adult stem cells are optimized physiologically, in my mind, make it a clear choice that we should use a person's own tissue. That's autologous tissue. And to further elucidate the reasoning behind that, the amount of time, energy, effort, staff time, space, and cost in harvesting a person's own tissue and processing, creating tissue grafts on site is far more costly and far less efficient than just taking a vial off of a shelf and injecting it into somebody. That's me saying, from an efficiency standpoint, an effort standpoint, and a cost and money standpoint, there is no positive to me doing autologous therapies. It would be much better for me to do allogeneic or other person tissue into a patient. From that perspective, what I'm saying to you is there's nothing in it for me other than to heal you using your own agents rather than somebody using somebody else's. I think that's something that everybody needs to consider very carefully before allowing a physician or other practitioner, oftentimes these are actually mid-level practitioners with very little injection experience, injecting what might be a very detrimental tissue graft into them.